You don't remember hearing him going like tap, 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 tap?
I remember
like,
all of that. He was,
like fracturing your nasal bones
and like whatever he was doing in there, like I remember it was the whole thing.
So what I'd like to know is, tell us when this all started. Give us a little history behind everything.
Well, I come from a long line of beautiful women. All have a hump on their nose. This is what God had to work with. Okay. But I don't feel like it was nearly as prominent on their face because their face is just shaped differently.
Right. So you had a bump, a hump.
Yes, exactly. Huge bump.
On a petite face.
Yes, and it was thicker too.
Was it straight?
It was. So when I was 16, we went to an ENT because I had a serious sinus infection, and he looked at me and was like, I can do something about that. And wanted to do, he was like, I can do something about that too. Like, you know.
Yeah.
So he wanted 2 for 1, take care of the humps.
Yeah, he did. Exactly.
Wait, let me ask you a question.
Yes.
Did he bring it up, or did you guys bring it up?
He brought it up.
What happened to Christy and her mother is retail medicine at its worst. She went in for a sinus infection, and they got offered a 2-for-1 rhinoplasty. Unbelievable.
What happened? You said no, though. I'm fine with mine.
Yes. Well, for one thing, who's going to take care of her?
So the first thing he said when he came out of surgery, there is a piece of cartilage that is a defect.
What was it?
Okay.
Well, he referred to it as like a deformity, like a flap, and he made it very clear that it was unavoidable.
It's looked like this since that day. It's just progressively gotten
worse.
Yeah.
Yes.
Lift your head back, lift your head up. I mean, was it that, the
Yes,
deviated
it's
septum?
100% what this is. Yes, it was.
Is that what we're talking about?
Yes.
When you are aggressive with the tip, and most doctors 25, 26 years ago, you remember this,
Yeah.
we were going there and just cutting away cartilage. Chrissy's nose does not have a deformity. Most likely the doctor took too much cartilage out, and that's what caused it to become crooked. And instead of admitting the error in his ways, he just blamed it on her nose and made excuses. The hump, though, was it better?
Yes, the hump was, I mean, it was a hump. I loved the fact that I liked my profile better, you know? So I focused on that. Then fast forward to me becoming a real estate broker. We slap our face on everything. So,
that's true.
yes, you know, it's just a constant thing still in the back of my head. I hate my nose.
I can see your beautiful face on a nice bus stop.
Okay.
You actually would look good with that.
Okay.
Listen, if I was gonna be on a billboard, of course, you know, looking good, looking, you know, just like this, nice and dapper, it'd have to be on Sunset Strip as you're driving down, all the traffic, everyone's cruising, and then you see my gorgeous picture up there. Would I like that? Yeah, I think I would.
So when I was in 3rd grade, I was in a wrestling match and I got cross-faced.
At that point, it was like pushed over to one side of your face, or?
Yeah, it looked like a knot right here, like it was crooked.
So it was a real break.
Yeah. I mean, I was little. I didn't care about my appearance until I started using social media to meet people. You know, I could talk to people all day long, but then meeting up, I was like, what are they gonna say about my nose?
So at that point, you said, I gotta take care of my nose?
Yeah, 5 years ago, I saw this billboard of this doctor that was like 3 hours away. I got a consultation right away. I drove to the doctor, I walked.
But he's on billboards?
Yeah, he
That's
was on.
what I told her. I was like, if he's advertising on billboards on the radio, then...
Yeah, what does that tell
Yeah.
you? If your plastic surgeon is good, would he be advertising himself on a billboard? Got boobs, got butts, got liposuction? He don't got patience.
He came in, but he only came in for a couple minutes, if that. And then the nurse was like, oh, hey, we can get you in tomorrow morning. I know it should have been a red flag, you know, an opening the very next day, and they're putting me in a hotel room that night. But at the time, I had no idea what the process was like.
What happened?
I got the surgery, and then I went to my doctor's appointment, like, for them to take the bandages off. The doctor wasn't even there.
Yeah.
We walked in, and then a girl, I don't even know if she was a nurse, took the bandages off. I just started bawling. It looked a lot more crooked. Yeah, it was devastating. I just felt like powerless at that point. The surgery did make it worse, and that hit my self-confidence even more. Then eventually, I started going to therapy.
Is that still continuing now?
Yeah, but I still feel like I have the worst nose in the world.
Okay. How many times a day do you look in the mirror at your nose?
All the time.
Although I can clearly see from across the room that Sarah's nose needs some help, but what I'm worried about is that she's very hypercritical of what she thinks of her nose. And with patients like that, no matter what you do for the nose, even if it's a great job, they're not gonna be happy. So what I wanna do is get her in the exam room and then have an honest discussion with her about realistic expectations and the complications and see if she is a candidate for surgery. As doctors that come in with a patient who basically says, listen, I feel I have the worst thing in my, my nose, but you are hyper-focusing on it. So that, right there, that kind of, makes it a little bit scary for us when we hear that. So Dr. Dubrow and I know a little bit from your history that you had one rhinoplasty.
I've had one. They told me I was gonna be under twilight. I was awake the whole time.
Oh boy. When someone's put under twilight sleep, that means they're breathing on their own and they're giving them a little bit of medicine in their IV and they just kind of go. However, with me and the type of cases that we do, they're long procedures, and that's why we like a full general anesthesia. You don't remember hearing him go like tap, 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 tap?
I remember all of that. He was,
like fracturing your
gives me the
bones
chest. And like whatever he was doing in there, like I remember, I was the whole thing.
If you don't give him the right amnestic medication, which makes you forget everything, you're gonna remember everything, especially like when they're breaking your nose and they're fracturing your bones.
Waking up in the middle of a surgery gives you a post-traumatic stress disorder a lot of times, and it can make you forever be afraid of ever having surgery again or anything associated with the medical system.
I do have that.
Yeah.
Yes.
As a doctor, we stand up and do the Hippocratic Oath. I will do no harm. Your doctor did you harm.
The next step for us to do is examine your nose and see what we can do.
Okay, perfect.
So what age did you get your first nose surgery?
When I was 18, so 28 years ago.
What did your nose look like?
So I had a nice little bump right here, and I had a golf ball on the end.
What happened?
So after the first surgery, the hump was gone, and a majority of this ball was gone.
After 3 months, when the swelling goes down, basically,
Right.
what did you actually start seeing?
So this started to drop, and then there was something right here. We needed to wait till at least 6 months before he would go in and do any sort of a revision. So when I went in for that next surgery, he's like, okay, lay down on the table.
You're
And
awake.
I'm like, okay, I was totally
Were
awake.
you awake for the first one?
I was not.
So the second was
But the second one, I'm awake. Like, you're awake, just numb you up. As they're numbing, he immediately gets the knife and starts cutting. And I'm like, oh, I can feel that. And he's like, shut up, you cannot feel that.
He said, shut up?
He did.
He said the word shut up.
He did.
You're sure?
Yeah, oh yeah,
A
I'm
doctor
positive.
told you to shut up.
Yes, most definitely.
How's your breathing?
My
How's all
breathing
that?
is horrible. I have to wear nose strips
Oh, you
almost
are.
every night.
Why has it been 28 years? I mean, why now? All of a sudden you're showing up here.
I was diagnosed with lupus. Thankfully, I'm in remission right now. So, yeah.
Great.
Next month will be a year. In the most basic terms, lupus is your own body attacking itself. If I don't do this now, while my lupus is a little bit in remission, I'm gonna lose this window.
It's good that you waited, especially for the healing aspects of it. It's really important for Lisa to be in remission from lupus because if you cause it again, and maybe the insult from surgery may do that, you have this auto-inflammation, the body attacks itself. And that could, one, cause her a complete systemic reaction to the lupus, or somehow it can cause problems healing with the nose, besides the breathing presently. Is the cosmetic aspects doing anything now to you?
I don't want these humps here, especially this huge one.
She'd like a symmetrical nose.
Actually, I went to another consultation, a couple, and one of them told me I get one more chance.
Yeah.
So the doctor said that you have one chance and that's it? Yeah.
You're worried about blood supply.
I don't want to have no nose.